Hello students, my name is G. Nikita, M. Pharmacy Assistant Professor, Department of the Pharmaceutical Chemistry. So I will deal the Medicinal Chemistry 2 subject for P Pharmacy third year's first semester. So today we are going to discuss about the anti-arrhythmic drugs. It is the third unit. So in this we will discuss introduction means what is the arrhythmiasis and what is the meaning of the arrhythmiasis and the classification and what are the drugs used in the treatment of the arrhythmiasis. Mechanism of action means how the drug will act in our body and how the drug is it will reduce the arrhythmiasis disease in the body and structure, synthesis, adverse drug reactions, and uses. So before discussing about the anti-arrhythmiasis drug, let's discuss about what is arrhythmiasis. So arrhythmiasis occurs due to the abnormalities in the normal rhythm of heart, causing irregularities in the heart rate. So it will cause due to the abnormalities in the heart rhythm, and also it will cause the irregularities in the heart rate. So SA is the sinoarterial node. So it is present in the right atrial. So it is present in the right part of the heart. So it will act as the pacemaker and which initiates the impulse. So this SA is mainly used to initiate the impulse in the heart. So if any of the abnormalities in the rhythm of the heart may hinder the formation as well as the conduction of the impulse through the heart. So if any of the abnormalities is there means it is termed as the arrhythmiasis. So next, what are the causes of the arrhythmiasis? So there are several reasons like heart underlying heart disease, thyroid disease, that is hyperthyroidism. Hyperthyroidism means excessive release of the thyroid hormone in the body. So excessive release means it will releases more than what we require for our body. Hypertension means raising of the blood pressure, heart wall problems, etc. And also the insufficient supply of the oxygen to the heart, acidosis, alkalosis, sympathetic and parasympathetic influence. And also the person, those who are in the treatment of the digitalis therapy also can cause the arrhythmiasis, and also the overstretching of the myocardial fibers can also cause the arrhythmiasis, and also due to the presence of the diseased tissue in the body. If the diseased tissue is present in the body, it can also cause us the arrhythmiasis, and some of the anti-arrhythmic drugs. It, in case of the curing the disease, it will in reverse. It will cause the arrhythmiasis. Means anti-arrhythmic drugs can also cause the arrhythmiasis problems, and also in some cases why this disease came, the reason we cannot able to find out. So these are the main causes. Next, what are the symptoms like palpitation means irregular heart rate and fluttering sensation in the chest, skipping of the heartbeat, difficulty in breathing because of the poor oxygen supply, chest pain and dizziness. Sometimes the person may faint because poor oxygenated blood supply to the brain. So these are the symptoms we can see in the person, those who are suffering from arrhythmiasis. Next, classification. So first one is class 1, is also known as sodium channel blockers. So they will have the membrane stabilizing or anesthetic effect on the cells of the myocardial. So this class 1 again divided into three types, that is class 1A, 1B and 1C. So let's discuss about class 1A. So it will block the sodium channel and it will slow down the zero phase depolarization. So example quinidine and prosinamide, diisopyridine, diisopyramide drug. So these are the three drugs, that is quinidine, prosinamide, diisopyramide. These are the three drugs which comes under the class 1A. What it will do? it will suppress the AV conduction and prolong the interval of the PR, QRS and QT potential duration. So this first drug is quinidine sulfate. So if you see the structure, this is the quinoline structure. See, this is the quinoline. In the sixth position, methoxy is there, and in the fourth position, the hydroxyl group. And here this is aza bicyclo, means two cyclics are there. See here one, two bicyclo, 8-membered ring structure, so it is octane. So aza bicyclooctane. In the fifth position, ethyl structure is attached. See here, quinoline. In sixth position, methoxy. Here one of the hydroxyl group. This is aza bicyclooctane. In fifth position, ethyl group is there, and this is the sulfate. Next one is prosinamide hydrochloride. So if you see the structure here, this is the phenyl for the benzamide structure. So this is the benzamide. See here, benzamide, and for the benzamide in the fourth position, the amine group is attached, and here ethyl, two carbon atoms are there. So this is ethyl. To this ethyl group, diethyl amine group is attached, and this is the hydrochloric acid. So this is the benzonamide. In the fourth position, amine group is attached, and this is the ethyl, and this is the diethyl amino hydrochloride. Next, diisopyramide phosphate. So diisopyramide phosphate. If you see the structure here, 1, 2, 3, and 4. 4 carbon atoms are there. So it is butyl. See here, 1, 2, 3, 4. Butyl. For the butyl, in the first position, amine group is there. In the second position, phenyl group. And here pyridine structure is there. Pyridine structure. And at the fourth position, two propyl groups are attached. So it is bispropyl amino. See here structure, 1, 2, 3, 4. So this is a butyl. In the first position, amine group is there. In the second position, phenyl and pyridine structure is there. And at the fourth position, bispropyl amino, and this is a phosphoric acid. Next, class 2b. These drugs is also inhibit the sodium channels in both activated state, but it shortens the phase 0 repolarization. So the drugs which comes under the class 1b are lidocaine and mexiletine and tocanide. So lidocaine, mexiletine and tocanide. So let's see the structures of the class 1b classification. So if you, the first drug is lidocaine hydrochloride. If you see the structure here, this is the phenyl. In the second and the sixth position, the two methyl groups are attached, and this is the amine group. And here 1, 2, 2 carbon atoms means ethyl. So for this ethyl here, two ethyl groups are there. So diethyl amino group is attached, and it is a hydrochloric acid. So here this is the phenyl structure. In second and sixth position, two methyl groups are attached, and this is the amino group. And here for this ethyl group, diethyl amino is attached at the second position, and it is the hydrochloric acid. Next one. So next drug name is methylating hydrochloride. If you see the structure here, this is a phenyl or benzoxy structure. So this is a phenoxy. So this is the phenoxy structure for the phenoxy. In the second and the sixth position, the methyl groups are attached. And here 1, 2, 3. 3 carbon atoms means the propane, and this is the amine group is attached here. See here, this is the phenoxy. In second and the sixth position, 2 methyl groups are attached, and this is the propane, this is the amine, and it is a hydrochloric acid. So next one is tokenide hydrochloride. So tokenide hydrochloride, if you see the structure here, 1, 2, 3. 3 carbon atoms means propane, and this is a propionic acid structure. Propionic acid structure. In the second position, the amino group is there, and here the third position of the propionic acid is attached to the phenyl group. So for this phenyl group, in the second and the sixth position, the methyl groups are attached. See here, in second and sixth position, methyl groups are attached. 1, 2, 3. So propane, this is a propionic acid. In second position, amine group is there, and here 2, 6 dimethyl phenyl is attached, and this is the hydrochloric acid. Next, phenytoin sodium. So if you see the structure here, this is the sodium, and this is the imidazole structure. See here, 5-membered ring with 2 nitrogen atoms. So this is the imidazole. In the second position, hydroxyl group is attached. In the fourth position, 2 phenyl groups are attached, and in fifth position, oxygen group is attached. See here structure. This is the sodium. This is the imidazole structure. In second position, hydroxide, and fifth position, oxygen group is there. In fourth position, 2 phenyl groups are attached. Next, class 1C. So it will also block the sodium channel It will block the sodium channel with marked slowing of the phase 0 depolarization, and they delay the conduction, prolonged PR and QRS complex, but have the variable effect on the action of potential duration. So some of the drugs which comes under the class 1C are, so the drugs are flecainide and propafenone and lorcainide. That is flecainide, propafenone and lorcainide. So let's discuss about the structure, the drugs which comes under the class 1C. So first one is flecainide. So this is the structure of the flecainide. So if you see in the structure, this is the benzonamide. See here, this is a benzonamide structure. And for this benzonamide, in the second position and the fifth position, trifluoroethoxy is present. Trifluoroethoxy. See here in the second position and the fifth position, trifluoroethoxy. 3 fluorine atoms are there. So it is attached in the second position. So 1, 2 carbon atoms means ethyl. In the second position, 3 fluorine atoms are there. So it is 2, 5 trifluoroethoxy. And here one of the methyl group is there, and this is piperidine structure. See here, this is the benzonamide. In second and the fifth position, trifluoroethoxy is there, and here this is a methyl, and this is a piperidine structure is attached. Next, propafenone. Next drug name is propafenone. So if you see the structure here, this is the phenyl. For the phenyl, in the second position, the phenoxy is present. See here, this is a 1, 2, 3, 3 carbon atoms, and with the oxygen is there. So it is the propioxy. 3 carbon atoms means propane. So propioxy, and this is the propyl amino. See here, 1, 2, 3. 3 carbon atoms with 1 amine group. So it is propyl amino. This is propoxy. And here in the first position, here phenyl group is there. For this phenyl, that is propane group is attached. 1, 2, 3. 3 carbon atoms with 1 oxygen. It is propane. So here this is the phenyl. For the phenyl in the first position, the another phenyl group is attached. This is a propione. And here this is the propoxy group is attached here. 1, 2, 3. 3 carbon atoms propoxy, and this is propyl amino is attached here. Next one is fluorocarbon hydrochloride. So this is the structure. So if you see here, this is the acetamide structure. See here, N C double bond O CH3. So this is the acetamide. For the acetamide, in the second position, phenyl group is there. In the here in the first position, here this is the piperidine structure. For this piperidine structure, in the first position, the propane structure. So 3 carbon atoms are there. So it is a propane. And here for the nitrogen, the 4-chloro-4-chlorophenyl. Because in the for the phenyl group ring at the fourth position, the chlorine atom is attached. So it is a 4-chlorophenyl. See, I will explain it again. This is the acetamide structure. In the second position, phenyl group, and here the piperidine structure is there. At the first position, propane structure, and here 4-chlorophenyl. This is the hydrochloric acid. Next, class 2 is also known as beta blocker. So it includes the beta adrenergic receptor blocking agent. So it will block the beta receptors, which decrease the myocardial response to epinephrine and norepinephrine because of their ability to block the beta blockers of the heart. So here we can see some of the drugs. Example like that is propranolol, esmolol, and butalol, sotalol, and timolol. So this drugs is all not only used in the treatment of the arrhythmiasis, but also used in the treatment of the hypertension and also the anginal treatment also. For this purpose also we can use this drug, that is propanol, esmolol, acetobutalol, acebutolol, sotalol, and timolol. So first drug is propanol. So if you see the structure of the propanol, that is, this is the naphthalene structure. See here, 2 6-membered ring are attached. So it is the naphthalene. In the first position, it is the oxygen is there, and here 1, 2, 3. 3 carbon atoms are there. So it is propane. And here, how many carbon atoms are there? 1, 2, 3. Propane, amine. See here, naphthalene, oxy, and this is the propane, and this is the amino, and another propane is attached here. And next one is esmolol. So this is the structure of the esmolol. So if you see the structure here, it is a phenyl. For the phenyl in the fourth position, this is the oxygen group, and here 1, 2, 3. 3 carbon atoms are there. So it is propox. So with in second position, the hydroxyl group is there. So it is propoxy. So it is the propoxy. 1, 2, 3. 3 carbon atoms in second position, hydroxyl group is there. So it is the propoxy. And here amine group, and here 1, 2, 3. 3 carbon atoms are there. So it is propane. Here in the first position, the propionate is attached. See here 1, 2, 3. 3 carbon atoms with 2 oxygen is named as propionate. Here phenyl. In the fourth position, oxygen. 1, 2, 3. 3 carbon atoms in the second position, hydroxyl group, that is propoxy. And here amine group, and here propane, and here propionate is present. Next one is acetobutolol. You see the structure of the acetobutolol. This is a phenyl. For this phenyl, in the third position, the acetyl group is there. See here, in the third position, acetyl group, and here in the fourth position, one, two, three. Three carbon atoms. In the second position, the hydroxyl group is there. So it is named as the 2-hydroxy propoxy. 2-hydroxy, and this is a propoxy, and here amine group is there, and here one, two, three. Three carbon atoms are there, so it is propane. And here again in the first position, one, two, three, four. Four carbon atoms are there, so it is the butane, and it is attached to the amide, so it is called butanamide. See here, this is a phenyl. In the third position, it is attached to the acetyl, and here in the fourth position, here one, two, three. Three carbon atoms. In second position, hydroxyl group is there. So it is propionamide propoxy, and this is the amine group, and this is a propane structure is there. In the first position, the butanamide is attached. Next one is sotalol. So if you see, this is the structure of the sotalol. So this is the structure of the sotalol, and this is the phenyl. For the phenyl, in the fourth position, two carbon atoms are there. So it is the ethyl. See here, ethyl, and in the first position, hydroxy group is there, and this is the amine group. And one, two, three. Three carbon atoms means that is the propane. And in the first position, the methyl and sulfonamide group is attached. See here, this is the phenyl. In the fourth position, ethyl. In first position, hydroxyl group, amine, and this is a propane. In the first position, methyl, and sulfonamide group is attached. So this is the structure of the timolol. If you see the structure, that is this is the thiadiazole. So thia means sulfur, aza means nitrogen. So two nitrogen atoms are there. So it is diazole. So it is named as thiadiazole. Here in the fourth position, the morphylone structure is attached. So morphylone, it is a six-member ring with oxygen and nitrogen is attached. So it is a morphylone at the fourth position. And here in the third position, one of the oxygen. And here one, two, three. Three carbon atoms means propane. In the second position, hydroxyl group is attached. So it is propane, 2-ol. And here amine group is attached. Here one, two, three, four. Four carbon atoms. So it is butane. So this is the thiadiazole. So this is the thiadiazole. In the fourth position, the morphylone structure is attached. Here in the third position, one of the oxygen and propane, 2-ol is attached. Here amino group, and this is a butane structure is attached here. Next one, class 3 is also known as potassium channel blockers. So this types of class, what it will do means it will block the potassium channels and also prolong the repolarization and refractory period. It will increase the ventricular fibrillation threshold. So these drugs are generally potassium channel blockers. So it will block the potassium channels in the body. So examples are betylium and amiodarone. So these are the two drugs, that is betylium and amiodarone comes under the class 2, is also known as calcium channel blockers. So this is the structure of the amiodarone. If you see here structure, this is the benzofuran. So one of the benzene. So this is the benzofuran. So this is the benzene structure and furan, the five member ring with oxygen group. So it is known as furan. So it is the benzofuran. Here in the second position, 1, 2, 3, 4. 4 carbon atoms are there. So it is butyl. And here in the third position, the carboxylic group is attached. And here this is the phenyl group. In second and the sixth position, the two iodines are there. So it is 2 comma 6 diiodo, and this is a phenoxy. And here 1 2 carbon atoms are there. So it is named as ethyl. And here 2 ethyl groups are there, diethyl amino. See here structure benzofuran. In second position, butyl is attached, and this is a carbonyl group. And here 2 comma 6 diiodophenoxy ethyl diethyl amino group is there. Next, beryllium structure. If you see here beryllium structure, this is the phenyl. In second position, bromine atom is there. So 2 bromo phenyl. So it is the 2 bromophenyl, and here methyl group is there, and the nitrogen is azanium. So nitrogen is named as azanium. Here 2 methyl groups are there and 1 ethyl group is attached. 2 bromophenyl, methyl, azanium, dimethyl phenyl is there. Ethyl is there. Next, class 4 is also known as calcium channel blocker. So what it will do, it will inhibit the movement of the calcium through the channel. So it will block the calcium and it does not allow the calcium to move outside into the body across the myocardial cell membrane and vesicular muscle by reducing the calcium flow. Conduction through SA node and AB node is slowed and refractory period is prolonged, resulting in the suppression of the arrhythmias. So here, what is the main functioning of the calcium channel for the contraction of the muscle? So if we inhibit the calcium channel, so there will be no the contraction of the muscles. So which results it will reduces the symptoms of the arrhythmias. And the examples are varapamil and diltiazem. So this drug is not only used in the treatment of the arrhythmias, but also it is used in the treatment of the anti-anginal agent. So it is also used for the angina treatment. So first drug is varapamil. So if you see the structure of the varapamil, 1, 2, 3, 4, 5. 5 carbon atoms are there. So it is the pentane. For the pentane, in the first position, the nitrile group is there. And again in the second position, 1, 2, 3. 3 carbon atoms are there. So it is propyl. And here in the second position, the phenol. 3 comma 4 methoxy phenyl is there. See in third and fourth position, the methoxy groups are attached. So 3 comma 4 dimethoxy phenyl. And again here in the fifth position, the methyl amino group is there. This methyl amino group is attached to the 2 carbon atoms. So it is named as ethyl. And this ethyl is attached to this 3 comma 4 dimethoxyphenyl structure. 1, 2, 3, 4 means pentane. This is in first position nitrile is there. And again in the second position 3 comma 4 dimethoxyphenyl. And this is a propane. The in fifth position methyl amino group, and this is the ethyl structure. And here 3 comma 4 dimethoxyphenyl group is attached. Next one is diltiazem. If you see the structure of the diltiazem, that is benzo diazepine. See here, this is a benzodiazepine. So this is the benzodiazepine. So means the presence thia means sulfur, aza means nitrogen. So it is a benzodiazepine. In the second position, the 4-methoxyphenyl is there. So for the phenyl structure in the fourth position, the methoxy is attached. So it is 4-methoxyphenyl. And again here in the third position, the acetyl group is attached. And here in the fifth position, 1, 2. 2 carbon atoms means ethyl. For this ethyl, dimethyl amino group is attached. 2 methyl groups are there. So it is dimethyl amino. Here this is benzodiazepine. In the fifth position, ethyl and dimethyl amino. In second position, 4-methoxyphenyl. And here in the fourth position, double bond oxygen. And in first position, sulfur. And fifth position, nitrogen. And in the third position, acetate group is attached. Next miscellaneous drug, that is adenosine and digoxin. So if you see the structure of the adenosine, so if you see the structure of the adenosine, this is the purine. So purine structure in the sixth position amino group, and here in the first position oxoline structure is there. So for this oxoline structure in third and fourth position hydroxyl groups are there, 2 hydroxyl groups. So here in the fifth position, methyl and one of the hydroxyl group is there. So 5-hydroxymethyl and 3-4 diol oxolane is attached to the purine. And in the purine, sixth position amine group is there. See here, this is the purine. In sixth position amine group, and here in the first position oxolane, 3-4 diol 5-hydroxy methane structure is there. Next, digoxin structure. So this is the structure of the digoxin. So see this, there are 3 6-member ring, that is phenanthrene, and 1 5-member ring, that is pentane, cyclopentane. In 18th position and 19th position, 2 methyl groups are attached. And here in 12th and the 14th position, 2 hydroxyl groups is attached. In third position, the sugars group is attached. Here in the 17th position, the furon and furon is attached. So for the furon in the second position, oxygen is attached. See here, phenanthrene, cyclopentane. In third position, sugar group. And here in 18th and 19th position, the methyl group. In 12th and 14th position, hydroxyl groups. And here in the 17th position, furon group is attached. So this is the classification of the drugs which comes under the anti-arrhythmiasis.